The color of your urine might be the single fastest, cheapest, and most honest health check you never look at. And if you're over 50, ignoring it could mean missing a warning that your body has been shouting at you for months. In this video, you'll learn exactly what 6 different urine colors are trying to tell you about your kidneys, your liver, your hydration, and even your prostate. We'll go through the shades that are perfectly normal, the ones that just mean you need a glass of water, and the colors that should send you straight to your doctor. And stick around for the last one. It's the most misunderstood, and most people get it completely wrong. After age 50, a lot changes under the hood. Your kidneys don't filter as quickly as they used to. Your thirst reflex gets weaker, meaning you can become dehydrated without ever feeling thirsty. And you're more likely to be on medications that affect urine color and kidney function. So something as simple as the color in the toilet bowl can be an early clue that a silent problem is brewing. But here's the issue. Most people flush without looking, or they see a strange color and shrug it off, thinking it'll go away on its own. Sometimes it does. But sometimes that color is the only warning you get before something serious. You don't need a medical degree to understand these signals. You just need to know what to look for. 1. Clear or pale straw. Yellow, the gold standard. What it is. This is what healthy, well-hydrated urine looks like. It's pale, almost like lemonade or light straw. Why it matters. It means your kidneys are getting enough fluid to flush out waste products without being overloaded. For someone over 50, staying in this range is ideal. What most people miss. Many older adults think if a little water is good, a lot is better. But drinking excessive water, we're talking gallons a day, can actually be dangerous. It dilutes the sodium in your blood, leading to a condition called hyponatremia. That can cause confusion, seizures, even coma. So clear is not always best. If your urine looks completely like water every single time, you might be overdoing it. Actionable takeaway. Aim for pale yellow. If it's totally clear, ease up on fluid slightly. If it's darker, drink more. Simple. 2. Dark yellow or amber. Your body is begging for water. What it is. When urine turns deep yellow, like apple juice or dark honey, it's concentrated. Your kidneys are holding on to as much water as possible because they're not getting enough. Why it matters. Chronic dehydration after 50 is no small thing. It raises your risk of urinary tract infections, kidney stones, and even falls from dizziness. Plus, concentrated urine can irritate your bladder, making you feel like you have to go more often, which ironically makes some people drink less to avoid the bathroom. That's backward. What most people miss. Thirst is a late sign. By the time you feel thirsty, you're already mildly dehydrated. So don't wait for thirst. And here's the part that surprises most people. Coffee and tea do count toward your fluid intake, but they also have a mild diuretic effect. Water is still best. Actionable takeaway. If your urine is dark yellow, drink 2 glasses of water over the next hour. Check again. If it doesn't lighten, keep sipping throughout the day. 3. Brown or cola colored. Stop and pay attention. What it is. Urine that looks like strong tea, cola, or even root beer. This is not normal. Why it matters. Brown urine can mean a few things, and none of them should be ignored. The most common cause after 50 is severe dehydration. But if you've been drinking water and it's still brown, there are bigger concerns. It could be a sign of liver problems, hepatitis, or cirrhosis, because bilirubin builds up and spills into your urine. Or it could be muscle breakdown from a fall or overexertion, called rhabdomyolysis. Some medications, like the laxative Senna or the antibiotic metronidazole, can also turn urine brown. But here's what most people don't realize. Brown urine can also be blood that's been sitting in your bladder for a while. Old blood oxidizes and turns dark. So if you see brown, don't just assume it's dehydration. Actionable takeaway. Drink water. If it doesn't return to pale yellow within a day, call your doctor. Mention any new medications. And if you also have pale stools or yellowing of the eyes, go to urgent care. 4. Red or pink. The one you never ignore. What it is. Pink, red, or even smoky-looking urine. This is the color that gets most people's attention, and for good reason. Why it matters. Red urine almost always means blood, and blood in the urine, doctors call it hematuria, is never normal after 50. The most common causes are not always scary. A urinary tract infection, a kidney stone, or an enlarged prostate scraping the inside of your urethra. But here's the thing. It can also be the first and only sign of bladder cancer or kidney cancer, and at your age, the risk is higher. What most people miss. You don't need to see bright red blood. Even a faint pink tinge counts. Also, some foods can turn urine red. Beets, blackberries, rhubarb. So if you just ate a huge beet salad, relax. But if you haven't, or if it happens more than once, you need testing. Most doctors won't tell you this up front, but a single episode of painless blood in the urine after 50 warrants a full workup. That means imaging of your kidneys and a look inside your bladder with a camera. It sounds intense, but it catches problems early when they're treatable. Actionable takeaway. If you see pink or red and you haven't eaten beets, call your doctor this week. Don't wait to see if it goes away. Painless blood is actually more concerning than painful blood. 5. Orange. Sometimes food, sometimes liver. What it is: bright orange urine. Not dark amber, but actually orange. Why it matters. The most common cause is medication. Phenazopyridine, that's the over-the-counter pill for urinary pain, turns urine bright orange. So does the antibiotic rifampin and the chemotherapy drug doxorubicin. But if you're not on those, orange urine can point to a problem with your bile ducts or liver. It can also mean severe dehydration combined with something called bilirubin. What most people miss: vitamin supplements, especially high-dose B vitamins, can turn urine a shocking neon yellow-orange. That's harmless. But if the orange has a brownish tint, that's different. Pay close attention to this next one. If your urine is orange and your skin looks even slightly yellow, or your eyes have a yellow cast, that's jaundice. That's a medical appointment within 24 hours. Actionable takeaway. Check your medicine cabinet and vitamin bottles. If nothing explains the orange, and it lasts more than a day or two, see your doctor and ask for liver function tests. 6. Blue or green. Rare but real. What it is: yes, urine can turn blue or green. It's startling, but usually not an emergency. Why it matters. The most common cause is medication. Methylene blue, amitriptyline, cimetidine, and propofol can all do it. Certain food dyes in candy or sports drinks can also cause it. Very rarely, a bacterial infection called Pseudomonas can turn urine green. That's serious, but it usually happens in people with catheters or hospitalized patients. What most people miss: a condition called familial benign hypercalcemia. It's genetic and rare. Can also cause blue urine in children, but after 50, it's almost always meds or dyes. Actionable takeaway. Don't panic. Think about what you ate or took in the last 2 days. If you're not on any of those medications and it doesn't go away in a day, mention it to your doctor at your next visit. 7. Cloudy or foamy, the silent kidney signal. What it is: urine that looks hazy, murky, or has a lot of bubbles that don't disappear quickly. Why it matters. Cloudy urine often means a urinary tract infection, especially if it also smells bad or burns. But foamy urine, that's different. If you see a thick layer of foam that stays after you flush, it can mean protein is leaking into your urine. That's a sign of kidney damage. Most people don't realize that foam versus bubbles matter. Normal bubbles pop fast. Foam lingers, like the head on a beer. Here's what most people get wrong. They think if there's no pain, there's no problem. But early kidney disease is painless. You can lose 50% of your kidney function and feel absolutely fine. The foam is sometimes the only clue. Actionable takeaway. Next time you go, look before you flush. If the bubbles stick around for more than a few seconds, mention it to your doctor. A simple urine dipstick test can tell if there's protein. That test could save your kidneys. We've covered a lot so far, from normal pale yellow to the scary red and the confusing foam. But what's coming next might be the most important part of this entire video, because there's one color that scares doctors the most when they see it in someone over 50. And it's not the one you think. The color that scares doctors most. Not red, not brown. It's normal that changes suddenly. Here's the thing that surprises most people. Doctors don't panic over a single abnormal color nearly as much as they worry about a change from your personal normal. If you've always had dark yellow urine because you just don't drink much, that's one thing. But if you've had pale straw your whole life and suddenly it turns dark brown or red for no reason, that's the real alarm. Your body has a baseline. When that baseline shifts abruptly, something has changed. And after 50, the list of what can cause that shift includes high blood pressure that's silently damaging your kidneys, diabetes that's getting out of control, or even a medication interaction you didn't know about. Most doctors won't tell you this up front, but they love when patients come in saying, My urine changed color and I don't know why. That simple observation can lead to finding a problem at stage 1 instead of stage 4. Also, pay close attention to this. Your urine color after 50 is affected by how well your kidneys can concentrate urine, and that ability drops with age. So a color that meant mild dehydration at 30 might mean severe dehydration at 60. You can't compare yourself to a 20-year-old. You have to compare you to you from last year. One more thing most people miss. Medications for high blood pressure, especially diuretics like hydrochlorothiazide or furosemide, are designed to make you pee more. That can darken your urine even if you're drinking enough. It doesn't mean you're dehydrated. It means the medication is working. But it also means you need to be more intentional about water intake. And some blood pressure meds, like lisinopril, can rarely cause kidney issues that show up first as foamy urine. So if you're on any medication for your heart, blood pressure, or cholesterol, your urine color is an even more important signal. And here's a practical tip that almost no video mentions. Check your urine color at the same time of day. First morning urine is always more concentrated, so it will be darker. That's normal. The real test is your second or third trip of the day. By mid-afternoon, after you've had fluids, it should lighten up. If it's still dark by 3 p.m., you're not drinking enough. Keep a water bottle in your car, on your desk, by your chair. Sip throughout the day. Don't chug a quart at once. That just makes you run to the bathroom and doesn't hydrate you as well. Finally, let's talk about what you should absolutely not do. Never try to treat a strange urine color at home by taking cranberry pills, drinking baking soda water, or using any internet remedy. Cranberry can help prevent UTIs, but it won't fix blood or protein. And some home remedies can interact with your medications or make kidney problems worse. Also, don't ignore a color because it doesn't hurt. Remember, kidney disease, liver disease, and early bladder cancer are often painless. Pain is a late sign. By the time something hurts, you've lost valuable time. So let's bring this together. Your urine is not waste. It's a report card from your kidneys, your liver, and your bladder. After 50, checking that report card every day takes 10 seconds and costs nothing. Pale yellow means you're doing great. Dark yellow means drink water. Brown or cola-colored means pay attention. If water doesn't fix it, see a doctor. Red or pink, unless you ate beets, means call your doctor this week. Orange with yellow skin means possible liver trouble. Blue or green is almost always harmless from meds. And foamy, lingering bubbles could be the earliest sign of kidney damage. You are not being paranoid by looking before you flush. You are being smart. And in a healthcare system where appointments take weeks and specialists are backed up, being your own first detective is one of the most powerful things you can do. You don't need to be afraid of every color change. You just need to know which ones to act on. And now you do. If this video helped you understand your body a little better, there's a lot more where that came from. We make videos that turn complicated health signals into simple, actionable knowledge. No fear, no fluff, just what you actually need to know. So if you haven't already, consider subscribing so you don't miss the next one. And if you know someone over 50 who flushes without looking, share this video with them. It might be the most useful thing you send them all year. Thanks for watching, and take care of yourself.